Hello everyone. We are going to get this thing started now about viruses, so let's dive into it. $3. Let me go ahead and get that out of the way first. You didn't think I'd forget, did you? $3, if you would, go to joeyjohnsondo.com. Make your donation, one-time donation of $3 if you wouldn't mind. I would greatly appreciate it. So let's talk about DNA viruses. When we think DNA, we can remember this little thing that I've drawn. I don't know what you would call it, but I draw it and I like it. So I kind of came up with it to keep them straight for me. D is for double-stranded. Okay, they're all going to be double-stranded except for one. Parvo B19 because it be one line. Okay, so it be one line and it's not double-stranded. That's parvovirus B19. They're all icosahedral, so I say icasa. Okay, they're all icasa except for one, which is going to be Pox virus. Alright, that one is not going to be icosahedral. It is going to be a complex capsule. And then the rest they're all going to be non-segmented and they're all going to be non-polar. Okay, the only other thing we'll have to remember is which ones are enveloped and which ones are naked. So I've heard this one a lot. People say, you know, when you get a pap smear, you get a pap smear naked, right? But the only thing is, it doesn't help you remember that you're not talking about the pox virus, because once we get to DNAs, as you'll see, there's a pox virus P, there's Papoviridae, you've got parvovirus, you've got these two P's that are under Papoviridae. So here's what I say. You know, you can remember this one if you want to, but just remember the P is, you have to exclude pox virus. I say pardon all naked pappies, or pardon all pappies for being naked, okay? The pap reminds me that it's Papoviridae, so that covers both of these P's here, papilloma and polyoma virus. I say pardon because that helps me remember that we are talking about parvo B19 virus, that B1 line, and I say all because of the adenoviruses, and naked to help me remember that they are naked, they are not enveloped, okay? So they are non-enveloped. So now let's get started. DNA makes babies, right? So I remember a little DNA baby. This is the way that I like to look at it. That's the way I like to draw it, okay? If you're going to draw this at home, just remember draw the face first, write DNA there for the eyes, and I'll draw a box right here, draw one line over here to the side, one line over here, these are arms, and that will help you remember that these are the exceptions, okay? They are kind of off and disconnected from the rest of the body. Where's the hand? The hand is disconnected as well. Here's that hand, here's that hand. Alright, and then the feet are connected, so they're part of everything else being normal. Herpes virus, adenovirus, and then it's a boy, of course, because you've got two cojones right here, okay? Those are the two cojones, and the reason they're within that is because it helps you, for the mnemonic, to remember also that omas be bad. And why do omas be bad? Because those are all going to be your circular viruses, period. DNA and RNA, that covers all of them, okay? So draw those within a circle there so you remember those are your circulars, okay? Omas be bad. Your two omas, which are papilloma and polyoma. B for Hep B virus, bad. That's when we get into the RNA viruses. You'll learn about those later with the Bunya, arena, and the Delta virus, okay? I remember a bunion is round for Bunya virus, and arena is round for arena, and then Delta virus, I draw the lowercase Greek letter delta, which has an oval in it or a circle, and we'll go over that later. But anyhow, DNA viruses. Let's start over here on this arm with pox virus, okay? Molluscum contagiosum, that's actually supposed to be a mollusk right here, okay? It kind of looks like a hand. I don't know what a mollusk looks like. I should have looked it up probably. But hey, it works for me. It looks like a hand. So Molluscum contagiosum, it's going to have pearly, shiny skin papules. They're going to be umbilicated in the center, so it has a dimpled center. They are painless, and they are highly contagious. Person-to-person contact, okay? When you look at these things microscopically, what you may see is epidermal cells with abundant granular eosinophils in them, okay, in the cytoplasm, and so it pushes the nucleus peripherally. So the nucleus is not centered in Molluscum contagiosum. What I like to think of is, since the Molluscum contagiosum is umbilicated in the center macroscopically, when you look at it on the skin, then microscopically there's no room for the nucleus to be in the center, so it's pushed it peripherally, okay? This typically resolves by itself in 6 to 12 months. You just do supportive care. You can do surgical removal if needed, or cryotherapy. Most people say just do supportive care though. Smallpox virus right there, variola is the other name for smallpox. See him? He's mean mugging because he has small man syndrome. He's mad. Smallpox. Thing is, he's got little man syndrome because smallpox, ironically, is actually the largest, if I'm not mistaken, the largest DNA virus. But anyhow, So flu-like prodrome is going to happen with smallpox. If y'all remember my little list there about a word about rashes, go back to it from the last video if you don't remember it. But so you have a prodrome with flu-like symptoms followed by distinct rash stages. You're going to have macule, a papule, then you're going to have a vesicle, then a pustule, then a crust. Okay, so you're macking on a girl, you become a pappy. So macule to papule. Okay, then you have to get a vehicle. Now you're a pappy, right? You got to upgrade on the vehicles because you got little kids. So you want to get, a big minivan. So you go from being a mac to being a pappy to now having a vehicle, and you're going to have little kids with pus running out their nose and snot. Okay, pustule, and then crust. Okay, I don't know how you're going to remember crust, but just macule, papule, vehicle, or vesicle, pustule, crust. This rash spreads from the face to the limbs and then to the trunk last, and it's mostly coagulated on the face and extremities, okay, versus chickenpox, which is mostly coagulated on the trunk and the face. And it's going to have aerosol inhalation for transmission, and the Varicella-Virus is going to be attenuated for it. If you remember, well, I don't know if we talked about this one for smallpox, but you do remember that it's in your Mr. VZ MAPC, please. So let's talk about herpes viridae now, okay? There's a whole bunch of herpes all over the place, okay? You see all these, right? I'm going to count down. You have human herpes virus 1 and 2, human herpes virus 3, and then human herpes virus 4 is going to be EBV. Human herpes virus 5 is CMV. And I don't have that there. I apologize. Let me just draw it right there. I don't know what happened to it. CMV. Human herpes virus 6 and 7 is Roseola. Human herpes virus 8 is sarcoma. Okay, so let's kind of walk through these a little bit. I already have decided this is going to be a 2-part lecture series for DNA viruses, but that's okay. So human herpes virus 1, which is HSV1, which is herpes simplex virus 1. That's going to cause gingival mastitis and keratoconjunctivitis. Okay, you're going to have herpes labialis. I told you it affects both lips, the labia of the vagina, labia of the mouth. Okay, herpes virus 1 is up orally to the mouth. Herpes virus 2 is the labia of the vagina. Obviously, men get it as well, But so what you can get is if HSV1 ends up going systemic, it can go to your temporal lobe. It'll cause one-sided temporal lobe encephalitis. Alright, and so it's the most common form of sporadic encephalitis in the U.S. Also, it can cause Kluver-Bucy Syndrome if it were to get to the amygdala. So let's just kind of talk about that. So if you remember, the amygdala is the center of fear, okay, and also helps with memory. So this is going to be Kluver-Bucy Syndrome. Okay, and it's going to destroy the amygdala, and it's going to cause hypersexuality, hyperphagia, which we want to eat all the time, hyperorality. Remember, HSV1 affects the oral stuff anyway, and it's going to cause amnesia and agnosia, which means like you see something you don't know what it is because the amygdala helps with memory. Like I said, that's beneficial, so that when you see something like a snake, to be scared of it and remember that. So they'll be kind of fearless if this is destroyed. Also, it can cause Bell's palsy, and it lies latent in the trigeminal nerve. You'll learn that all these herpes viruses, they lie latent and then they reappear, and we'll talk about high yield stuff on that at the end of this. So transmitted via respiratory secretions and saliva. You can do a zinc smear on it. All right, you're looking for intranuclear inclusions if you do that. And let's see. Also, multinucleated giant cells are big about this. That results from the infusion of the infected cells, and so it makes some multinucleated giant cells. And you'll see that on a zinc smear. Acyclovir is going to be the virus of choice, and we talked about the thymidine kinase phosphorylating that. Human herpes virus 2, okay, when we get to that, that's going to be HSV2 as well, and so that causes genital herpes. If you have a neonate with herpes, think HSV2 because it's coming through the vaginal canal. It can cause meningitis in them, and it lies latent in the lumbar and sacral plexus since it affects the vagina down there. You get it through birth canal passage or sex, and treatment's the same, microscopic identification the same. HSV 3, which is Varicella-Zoster Virus. You've got chickenpox, which are varicella. You got herpes zoster, which is shingles. And so the chickenpox are thin vesicular rashes on an erythematous base. And what they always talk about is dewdrops on a rose petal. And what they mean by that is like there's an erythematous base, so it's red, right? And then you'll have these little dewdrop vesicles, right, that are fluid filled. And so those are the dewdrops on a rose petal look, or the erythematous base with vesicle lesions on top of it, okay? And so if it's later on, after it's latent in the spine, it can come back out as herpes zoster during times of stress and later in age, and that's going to be precipitated by sensory nerve tingling, burning sensation, pain, and it's usually on an intercostal trunk nerve or cranial nerve. It can have long-lasting postherpetic neuralgia, typically for older folks, and severe infections may spread to the lungs or brains, and it has a dermatomal pattern that's big about that. And you can pretty much test it the same. You're looking for Caldry, type A inclusion bodies, because type B inclusion bodies is going to be polio. So these will have Caldry type A inclusion bodies. Airway droplets is going to help spread this. Also the fluid during the times of infectiveness, acyclovir to fix it. HHV4, which is Epstein-Barr Virus, okay, mononucleosis is what it calls. It's the kissing disease, right? Typically affects people 15 to 25, all right? That's associated as well with Burkitt's lymphoma in Africa. It's typically a B-cell lymphoma. What it causes is infectious mono, so it's going to cause sore throat, easy fatiguing, cytotoxic CD8 T cells in the blood. It also binds to CD21, which, those are B-cell stuff. When you get up into high CDs like that, low CDs are typically T cells, high CD numbers, B cells, so B-cell 21, all right, at the C3D receptor. Not probably that high yield, but just remember, mild in a child, but bolder as you get older. As you get older, EBV becomes much more serious, okay? And so microscopically, you're looking for early monospot testing because it causes mononucleosis. You test for heterophil antibody agglutinating stuff, so that's going to test with horse or with sheep blood. If you have horse blood versus sheep red blood cells, okay, the sheep red blood cells are going to agglutinate in the presence of heterophile antibodies, and that's called the Paul, also known as the Paul-Bunnell test, okay, Paul-Bunnell test. All right, if you're looking at the horse RBCs, then that's going to, on exposure to heterophile antibodies, that's going to be the monospot test, okay? Just in case you see these listed as other things, monospot is the horse blood, Paul-Bunnell is the sheep's blood, the P for P, and I'm saying red blood cells, RBC. So things that can cause a false negative with these, though, you can get CMV, toxoplasmosis gondii, HIV or HHV 6 and 7, which is Roseola or leukemia, okay? And so now let's talk about HHV 5. All right, HHV 5 is CMV, okay, Cytomegalovirus. And so a little way that you can remember that one is, all right, CMV, okay, for cytomegalovirus. It causes colitis. It also causes mouth ulcers and dysphagia from the mouth ulcers and visual issues, visual problems. It lays latent in different tissues. It can cause intracerebral calcifications. And you're always looking for this disease in AIDS patients because it's opportunistic like others are. And cytomegalovirus, so it causes swollen cells, okay, giant cells. And you'll see owl's eyes, okay, look those up if you don't know what they look like. They're kind of like that. You'll see big owl's eyes when you look at them microscopically. And so you treat this one with gang-cyclovir. Acyclovir was for the herpes, gang-cyclovir is for this one, okay. And so then Roseola, if you remember looking at that list, I won't go over it much, just very high fever, sudden onset high fever, spiking, and fever will be up to 40 degrees Celsius for several days, can cause seizures even. So you have a 4-day spike of high fever, then a rash up to 2 days. The rash goes from the body to the extremities, so the rose is close to your heart, I told you, then it goes outward, also known as Roseola infantum, and gang-cyclovir will be used for that as well. This is Roseola, not rubella. Remember, this is Roseola we're talking about. We'll get to rubella later. Finally, HHV8, which is Kaposi's, okay. Basically, you're going to do a biopsy and see spindle cells for Kaposi. It's the #1 cancer in AIDS patients. It causes many red, purple, kind of dark brown nodular lesions on the skin, in the mouth, in GI or respiratory tracts as well. And so that is going to complete this. We'll review where these things lie latent, the herpes viruses, in DNA lecture 2. Thank you. $3. That's all I'm going to say. $3.